For my presentation for bio-231 section 78489, I decided to do tuberculosis. I decided to do this because I've had TB tests done and I was always curious to why we have to have those done and how come it's still an issue when it's been around for quite a while. Tuberculosis, also known as TB, is caused by a bacterium called Mycobacterium tuberculosis. The bacteria typically invades or attacks the lungs. It can also attack other areas of the body, such as the kidney, the spine, and the brain. Not everyone who is infected by the bacteria becomes sick. However, if not treated properly, the disease can be fatal. It is the top infectious killer in the world, not the top killer, but it is infectious disease, so that's why it's the top infectious killer in the world. In the year 2019, 1.4 million people died from TB. Symptoms of TB. A bad cough that lasts 3 weeks or longer, pain in the chest, coughing up blood or phlegm from deep inside the lungs, weakness or fatigue, weight loss, no appetite or loss of a normal appetite, chills, fever, and sweating at night. How it spreads. TB spreads by germs that are put into the air when a person with TB of the lungs or throat coughs, sneezes, or speaks. The germs can stay in the air for several hours. When people breathe in the germ-infected air, that is how they become sick. This is known as a latent TB infection. You cannot get it from drinking glasses, eating utensils, a handshake, toilets, or other surfaces. Pathophysiology. The bacteria tubercle bacilli invades the lungs via droplets in the air. The droplets are small enough, at 5 to 10 microns, to reach the alveolar spaces within the lungs. If the immune system does not fight the infection in time, then it will move inside the alveolar macrophages and eventually kill the cells. Infected macrophages produce cytokines and chemokines that attract other phagocytic cells. The cells eventually form a nodular granulomatous structure called the tubercle. If the bacteria replication is not controlled internally, the tubercle enlarges and the bacilli enter local draining lymph nodes. If the immune system cannot activate effective cell-mediated immune response, then it will lead to progressive destruction of the lung. Latent TB versus TB disease. Latent TB is when a person has the TB germs inside of their bodies, but the germs are not active. They do not have any symptoms, and they cannot spread the germs. However, they may still develop the disease in the future. People with TB disease have the germs inside of the body that are active. The germs are multiplying and destroying the tissues that are inside the body. People with TB disease have symptoms. They can develop symptoms soon or years after becoming infected. The immune system naturally tries to fight the infection. High risk. Certain people are higher risk than others. Those who have recently been infected with the TB bacteria. People are persons with medical conditions that weaken the immune system, such as those with an HIV infection, people who have substance abuse problems, those who have diabetes, people with severe kidney disease, individuals that have had organ transplants, and babies and young children. Those that are high risk to be recently infected or more easily infected are those who are more likely to get the disease than those ones that are in close contact with someone who has an infectious TB disease. Children less than 5 years who have a positive TB test, and groups of high rate of TB transmission, such as people who are homeless, injecting drug users, and people with HIV. Like with most infectious diseases or any kind of illnesses, people that work in hospitals, people that work in homeless shelters, nursing homes are around those who already have HIV are more likely to be infected. People who have immigrated from areas in the world where TB is high risk. The top 4 places where TB is the highest are India, Indonesia, South Africa, and China. Out of those 4 places, TB is highest in India. India is the highest with 27%. There are several reasons why TB is so high in other countries in comparison to the United States. Delay of diagnosis is one of the reasons why TB is so high. Also, the lack of testing equipment, drug resistance, and I found out that air pollution has a lot to do with why those rates are so high in other countries. I was also curious, I found a lot of research about how people with HIV are more likely to get it. So I did a little bit of research about HIV and why those people are more likely to get it than others. HIV is a viral infection that affects the immune system. When HIV enters the human body, it produces a protein called VPU that directly combats a critical defense protein of the human immune system. TB is known as an opportunistic infection. An opportunistic infection is an infection that occurs more frequently or is more severe in people with weakened immune systems, such as people with HIV, or people receiving chemotherapy than in people with a healthy immune system. Untreated latent TB infection is more likely to advance to TB disease in people with HIV. All right, now we're going to talk about testing for TB. There are 2 different types of tests that can be performed. The test can be performed multiple times, and almost everyone can receive a test, including infants, children, pregnant women, people living with HIV. One of the 2 tests that can be done is a TB blood test, also known as interferon gamma release assays, or IGRAs. The ones that are available in the United States are known as the QuantiFERON TB Gold Plus and the T-Spot TB test. Those are the 2 types of the blood tests. There is also a skin test that can be performed. The TB skin test is also known as the Manitoux tuberculin test. This one is the most common way of testing. It is performed by injecting a small amount of fluid into the skin on the lower part of the arm. A small bump will appear. The person must return to within 48 to 72 hours to have a trained healthcare provider read the results. The results depend on the size of the hard, raised, or swelling bump that is on the skin. Reading the results. A positive skin test result means that the person was infected with TB. However, additional tests need to determine if it was latent TB or actual TB disease. A negative skin test means that the infection or disease is not likely. A posterior anterior chest ray is an additional test that can be performed if a person is suspected of having TB. A chest X-ray shows advanced pulmonary tuberculosis. In active pulmonary TB, it infiltrates the cavities and is often seen in the upper lobes of the lungs. Old healed TB usually presents as pulmonary nodules in the upper lungs, so it does create scarring. Vaccines. Vaccines were first proposed in the year 1890 by Robert Koch. It was first used on humans in the year 1921. It was made by weakening a strain of bacteria that is similar to TB that was first isolated in cows. Although not everyone needs a TB vaccination, it is only suggested for use where TB is common. Then it is usually given to infants and small children because it does not work well in adults. Getting the vaccine does not always protect people from getting the virus. The vaccination name is Bacille calumet urine, or BCG. Vaccines are recommended for children who are untreated or ineffectively treated for TB disease. It is recommended for children who cannot be given long-term primary preventive treatments for a TB infection. It is also recommended to healthcare workers, and also if there is a high percentage of patients within a small area that have TB infection. If there is an ongoing transmission of drug-resistant TB strain, and also if there is not proper control precautions in place. Treatment for TB disease. When TB is active in the body and the immune system cannot stop it on its own, there are drugs that can be introduced. TB disease is treated by taking several drugs over a period of 6 to 9 months. There are 10 drugs that are currently approved by the United States. The first line of anti-TB agents that are the core treatment are isoniazid, rifamycin, ethambutol, pyrazinamide, and rifapentine. As with all medications, it is important to finish all the medicine exactly as prescribed. If someone stops taking the drugs too soon, they can become sick again, or if the drugs are not taken correctly, the TB bacteria can become drug resistant, and it gets harder and more expensive to treat. Patients on treatment for TB can experience adverse side effects, such as unexplained loss of appetite, nausea or vomiting, brown urine or jaundice, persistent tingling, numbness, or burning of the hands or feet, persistent weakness, fatigue, fever, or abdominal tenderness, easy bruising or bleeding, blurred vision or changed vision. Drug interactions. Drug interactions can occur with other medications. The drugs I'm talking about are the drugs that are given when someone has TB disease. Isoniazid can increase blood levels of phenytoin and disulfiram. Rifampin can decrease blood levels of many drugs, including oral contraceptives, warfarin, and other blood thinners. Also, HIV individuals who are being treated with protease inhibitors can have possible drug interactions. When on treatment with isoniazid and rifampicin occurs in 12 once-weekly doses. Baseline liver chemistry blood tests are done for those with an HIV infection, those with liver disorders, or those taking previous medications that can interact. Always have the baseline liver chemistry blood test done. Monthly evaluations occur to check for adverse systemic drug reactions. Those reactions include loss of appetite, vomiting, yellow eyes, tenderness of the liver, easy bruising, and a rash. Hypersensitivity reactions such as hypotension, which is low blood pressure, thrombocytopenia, which is low blood platelet count, can occur when on treatment. Now I have some TB number facts. When TB was first discovered around the year 1953, it was at a 52.6% infection rate. Within the first 10 years after its discovery, it dropped down to a 28.6%, which was in the year 1963. Jumping forward to the year 2010, still dropping down to only 3.6% of the population. And in the year 2019, it dropped down to 2.7% of the population. So it has dramatically dropped down from when it was first discovered, although it is still an issue. Since it was a major disease back in the 50s and 60s, and it's not as, I guess, dominant now, I didn't really find too many famous people that had it. There was two. The famous writer of the book Animal Farm, George Orwell, died from TB disease in the year 1950 when an artery burst in his lung. An actress named Vivian Leigh, also she starred in the movies Gone with the Wind and A Streetcar Named Desire. contracted the disease in the year 1945, but she did not die from it until the year 1967. So she had latent TB, which turned into TB disease. Ending TB. Although TB disease is not completely eliminated, the numbers have dropped significantly. Ending TB would require a dual approach in maintaining and strengthening current TB control priorities while increasing effort to identify and treat latent TB infection. And that is the end of my presentation. I feel like I did learn a lot about TB, and that is all. If I can figure out how to stop recording.